Let's go. My name is Dr. MarkAlain Dery, and I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access South Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. You see me do these updates now for over a year in conjunction with the leadership of the ACOI. Hello, leadership at ACOI. Thank you for letting me do these videos. And I hope these messages are helping you keep up with the latest on COVID-19. I know many of you are continuing to fight, and for many, that effort is centered around convincing individuals to get vaccinated. Me too. So wherever you are in this pandemic battle, I'd like to thank you on behalf of all of us who focus daily on infectious diseases, and certainly on behalf of the ACOI. Hello, ACOI. So moving together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress we are seeing. And I think we're seeing hopeful progress. We do have good news today. But let me end my intro by saying that the 2021 ACOI Convention and Scientific Sessions is happening. Yes! So hurry. I hear there are very limited hotel rooms at the convention hotel, so sign up today. I want to see you there. I'll be there. Okay, on to the stories. So let's talk about the Delta variant. Yikes, this is a real. All right, so as vaccination rates decline in this country, why are vaccination rates declining in this country? It needs to be said that the slower the vaccination rate, the more likely deadly variants will arise and erode vaccine efficacy. The Delta variant is a perfect example of this. Now, the variant, initially known as B1617, is particularly concerning. You may remember as it originated from India. Now today it is accounting for 6% of all U.S. infections and up to 18% of cases in the Western U.S. In the U.K., it's responsible for more than 60% of cases, and according to British Prime Minister Boris Johnson, that means that the full reopening of the country after COVID lockdown may be delayed from the scheduled date of June 21st. Now, here in the U.S., my buddy, Dr. Fauci, and his concern, call me Dr. Fauci, let's do lunch. He said that this week that the Delta variant is likely associated with more severe disease and a higher risk of hospitalization, and that the Delta variant is more dangerous in states where the vaccination rate in populations is less than 50%. Like right here in Louisiana. He's also warning that younger people are still being hospitalized and they're dying of COVID. Now, why? That's because about 80% of people 65 and older have gotten the vaccine, and as a result, we have lower hospitalizations and deaths in that age group. Now, the younger people who are avoiding getting vaccinated are now the ones filling up emergency rooms and hospital as they're being hit with severe symptoms. Now, while vaccinated people are obviously safer, there are a whole host of people, hint, hint, like the ones that are not vaccinated in the U.S. who are not, and they are extremely susceptible to the virus, as it has been declared to be 60% more transmissible than the original wild-type virus. Now, the vaccines are holding up against the Delta variant, but their efficacy is a bit less. A recent study showed that the Pfizer-BioNTech vaccine is 88% effective compared to the typical number that we talk about with 93% efficacy against the Alpha variant. Now, rather against the wild-type virus. Now, after only one dose, however, that efficacy falls to just 33%. That means Americans can't skip those second doses of the mRNA vaccines. They really matter. So encourage your patients to stick with their vaccine schedule if they get the Moderna or Pfizer vaccines, because they need both doses. And this is really important. I think we're going to be hearing a lot more about the Delta variant, and we're going to see the Delta variant in communities that are unvaccinated. And so we'll continue to follow this story here on this ACOI COVID vlog. All right, so on to the next story. We need to recognize that COVID is still here. Now, I am not a pessimist. Really, I am not. And last week during this video blog, I celebrated we are at the lowest point for COVID deaths and cases since March 2020. And I'm still celebrating that. But COVID is continuing to kill hundreds of people daily. In late May, deaths were tracked to about 2,500 people per week. This is a yearly rate of about 130,000 people if that cadence continues. Opioids, a horrible epidemic in this country, are killing far less people. Influenza and pneumonia together kill around 50,000 people per year. The flu alone, in average, logs about 30,000 deaths. So don't believe people who tell you that COVID is just like the flu. It's just not. Only cancer and heart disease are killing more people each year. COVID is now the third leading cause of death. So who are these people who are dying of COVID, especially now with the vaccine here and widely available? Let me preface this by saying, by and large, people in the U.S., the people who are getting sick and dying of COVID are, and you guessed it, the unvaccinated. As I said earlier, younger people are increasingly getting sick. People over 60 who've had numerous comorbidities were previously the ones likely to get struck with severe COVID symptoms. Now, we are seeing increases in the 50 to 74 age group. I'm in that age group. The 50 to 74 age group on the lower side of that age group. The 50 to 74 age group, and in the 30 to 49 age group, as well as in the under 30 age group. So, as I said earlier, more than 80% of those that are 65 and older have had at least one dose of a COVID-19 vaccine, compared about half of those aged 25 to 64 who have received one dose. And okay, boomers are leading this, so come on millennials, come on Gen Z, and come on Gen X, you can beat that. Now, data collected by the CDC on so-called breakthrough infections, those that happen to vaccinated people, suggest an exceedingly low mortality rate among people who have received a COVID-19 vaccine. But really, are we really surprised by that? No. Now, part of the problem is that younger people are believing the false narrative that because they are young, they can't get a bad case of COVID-19. Wrong. You're wrong. You're wrong about that. Wrong. Still, those 50 and older continue to make up the bulk of COVID-19 deaths. And among that group, white Americans are driving the shifts in death patterns. At the height of the pandemic, those who were white and age 75 and older accounted for more than half of all COVID-19 deaths. Now they make up less than a third. So middle-aged populations of all racial groups are making up the higher share of COVID-19 deaths compared with their shares in December. The extent of that drop in deaths, however, is not uniform across the board, and cumulative vaccination rates amongst Black and Hispanic populations continue to lag behind those of Asian and white populations, according to demographic data released by the CDC. Shockingly, nursing homes are still getting hit. Yes, their COVID death rates have dropped more than 90%, but there's still about 200 people per week that are dying in those facilities. That just pains me to say that. And unfortunately, deaths will continue because the bigger disease of misinformation and politicization around the vaccine has created a group of people who simply refuse to be inoculated. The other groups who are getting vaccinated are those who may either have other reasons or other issues with access. And either way, we can't stop the steady drumbeat with our patients and continue to tell them that vaccination is the answer to ending this pandemic, and to increase your chances of less severity, that they too increase their chances of less severity should they become infected with the virus. I can't urge and I can't stress how important the vaccine is, and we really need to continue to make concerted efforts to our patients. Remember, we're doctors, and our patients do listen to us. All right, some good news here, and something I'm very happy to talk about, and that is already 7 million teens have already received at least one dose of the Pfizer vaccine in the U.S., and all of this counts toward the unending hope of herd immunity. Now, other good news is that Pfizer this week said that they're going to begin testing their vaccine on up to 4,500 kids in the U.S., Finland, Poland, and Spain. And a Pfizer spokesman said the company expects data from 5 to 11-year-olds in just a few months, and it looks like September. And they will likely ask regulators for emergency use authorizations later that month. Data for children 2 to 5 years old could arrive soon after that. And Pfizer expects to have data from the 6-month to 2-year group sometime in October or November. And also, I'd like to point out that where vaccination rates are looking good, and today's winner is Seattle. It was announced that they are the first major American city to fully vaccinate 70% of their residents 12 years and older. So, congratulations, Seattle. Bravo. Previously, San Francisco had been leading the country, and the state of Vermont was the most vaccinated state. Seattle continues to have the lowest cases, hospitalizations, and deaths in every major city. And some officials estimate that the countywide, there's an estimated 97% of all new cases are in individuals who are not fully vaccinated. And that, my folks, is why Emerald City is such a gem. So stay on the lookout for these regular updates, and to read more from the sources used in this report, go to acoi.org/COVID-19. I'll get that right eventually. I've only been doing this for 18 months. Together with the ACOI, we'll help you have the latest information to help you respond to your patients and stay on top of the crisis. Please feel free to reach out to me at madery@mac.com. Please stay safe. We can do this together. As always, thank you so much, Gina.